TSD in the Community Forum on Health, overall health, mental health, physical, emotional well-being. For some of us in the audience, we have more days behind us than we do ahead, and so tonight we're talking about how can we be prepared to live well. Health, sometimes we think about working out, what we're eating, but it's everything that we ingest. Our interactions with people, our emotions, our energy, but definitely that space in between our ears, our brain. And so tonight we have an esteemed panel, and I will not introduce them. I'll allow them to introduce themselves and tell us a little bit about them. So I'm Lori Spicer Robertson, glad to be your moderator. Thank you, Tri-State, for having me again. And I will start with Judge Renfroe. Please tell us whatever you'd like to tell us, but also how do you maintain your health? What's unexpected that we wouldn't think about for you?
Good afternoon, and thank you for having me. I am so pleased to be here with you. I'm so pleased for this forum. Thank you, Deidre Malone, for asking me to be here today. I am the judge of Shelby County Mental Health Court, Division 9 in General Sessions. I've had that position since 2022 when I was elected, and I think mental health has been more, I guess, prevalent in the community as far as it shows up in people's acceptance of it. The stigma, I think, is finally starting to disappear when it comes to mental health, and I'm just proud to be a part of that. And I guess one of my unexpected things is something typical, a bubble bath, a nice book, and a good meal. It's something I like to comfort me and keep my mental health in check.
Dr. Patrick Malone. I'm a native of Chicago and been here in Memphis since 1986. And I'm an internal medicine specialist by training, but primarily have been involved in primary care for most of my medical career. I really started out my primary care here at Memphis Health Center back in 1991. I stayed here and worked here for 3 years. I still feel like that this is my family too. Right now I'm currently working for Regional 1 Hollywood Primary Care Clinic, so I've been doing primary care for a long time. For a good period of time I served dual role administrator as well as care provider, so I've always stayed in touch with the patients, and as of now I still enjoy doing what I do. I think that being primary care is much needed, and there's still a lot to be done with primary care and healthcare overall, but I'm not going to go into all of that. As far as for what do I do to maintain my mental health, I think just try to keep telling myself to control what I can't control, and the stuff that I can't control, try not to worry too much about it. It's always going to be something, so never feel that you've accomplished everything, because when you feel that way, right around the corner, someone's waiting to step in there. So I just try to stay calm and relaxed.
My name is Dr. Veronica Gant. I'm a doctoral nurse practitioner here at Memphis Health Center. I'm the clinical director. Been in this role about 7 months now, but I've been with Memphis Health Center about 3 years as a family nurse practitioner. I enjoy my role. I enjoy the interaction I have with patients and co-workers, staff, because it becomes more like family. I've been in nursing about 27 years now. I started as a CNA, trying to figure out my way, and was able to work my way through and get to where I am today. Some of the things I've learned to do is just to turn things off sometimes. Sometimes we have to detach what that looks like. Sometimes you turn your phone off, put your phone across the room so you won't be, not want to answer the phone, answer text. You get those all night. That way you can, get quality sleep. Also, putting the phone across the room, so in the morning you'll have to get up to turn your alarm off to go ahead and start your day. What that looks like, meditation, prayer, those kind of things to go ahead and get your day started.
All right, so you have heard from our panelists on how you can protect your own health. Sometimes we have to disconnect, pray, think about what you control and only focus on what you control, and then take a good bubble bath, read a book. Did you say drink some wine? Or I added that myself. I did, okay. Yes, add that to your list. Give them a round of applause. Thank you. All right, so we're going to jump right in, starting with you, Dr. Malone. So you work in internal medicine, and as we're thinking about what's ailing patients, what do you wish people could think about or plan for better of how their health is impacting their lives, right, before the diagnosis? What should they do differently? What should we be considering? As a physician who's been in this practice for a long time, I'm sure you've seen everything. What would you tell your patients?
Well, one phrase I like to tell them is that you can't disconnect the head from the body. What affects us mentally ultimately affects us physically and vice versa. And try to find a good place and stay there as long as you can.
Put the mic up, Dr. Moore. Close. Thank you.
I'm new at this. And again, I think if we value our health, we would take better care of ourselves. Many times I see patients maybe once every 2 years, and even though that's not the plan, we don't talk about it, but as a provider, I want to get to the point to where I feel like they can feel comfortable with me. I think one of the things about primary care is that if you stay in a place long enough, you develop relationships with the patients. And many times the patients will talk to you about things that they don't talk to the family members about. And frankly, there are some patients that really the only time they get to have a conversation with people is when they go to the doctor or go visit their attorney. So I try to listen. Even though sometimes I get accused of staying in the room with the patient too long because I'm trying to listen to them. But sometimes if you listen long enough, the answers come to you, or it comes to the patient. And if they can leave out feeling better than they did when they came in, then I think that's a service. But there's a lot of things going on that distracts patients and make people just feel like giving up. And I try to encourage people because that's part of what we need sometimes. It's just that kind word, reassurance that they're doing things, and results matter. If you come in and blood pressure's always up and you manage to get it down, that's something that you can actually feel good about. And I'm always trying to be positive, even when things don't look good. We just try to give hope and reassurance and just treat people the way that we want to be treated. That's that golden rule that always supersedes everything for me.
Thank you. We appreciate that good bedside manner, so you continue being in the room as long as you need to be to keep our community healthy. Dr. Gant, I'm turning to you. For the communities and the patients that you serve, what does being healthy actually look like, and how is it different from mainstream media and how it portrays wellness?
What does healthy look like in the community? Well, it depends on who you're speaking to when we talk about what does being healthy look like. As providers, we always say eating certain amount of servings of fruits, vegetables, make sure you exercise and doing this, the other. Some patients look at being healthy as long as I'm breathing, I'm doing okay. But what that looks like is having consistent access to food. It's not all fat, high-fat foods, but just healthy options that they'll be able to afford. What that also looks like is getting quality sleep. We know some neighborhoods or sometimes you're not able to sleep because all they hear is bullets or guns going off. So being able to sleep at night, that's one of the things. Being able to manage stress. A lot of times we all go through some things, but being able to manage those without leading to health issues or problems. One of the most important things is to have positive support from family, friends, and church members. These things will all contribute to a healthy living if we can get these in place. Now, how that differs from mainstream media, a lot of times we see the perfect bodies. Everyone having access to meals, eat good, able to exercise, fair wages, everybody blue collar on up. That's the difference than what we see than what we're actually living in.
Thank you. Okay, Judge Renfroe, question is for you. So we're switching gears. When you opened up, you talked about how the stigma has shifted a little bit around mental health. And I question, has it shifted in our community, especially as you think about children? We went to go visit a school today, and one of the teachers just was talking about the challenges that children have and sometimes parents have around mental health. What does, from your seat, how do these behavioral issues show up? And sometimes in the court, are they really behavioral issues versus health issues? And how is our system not addressing or meeting those needs and demands in our community?
That was a loaded question.
It was. I was like, let's get into the meat of this. This was the soft side of health. Let's get into it deeper.
Well, fortunately, before I was elected to this position in adult court, and General Sessions is an adult court, 18 and above, I was working at General Sessions, and I had the privilege of being asked, based on my interest in mental health, to put together a lot of the treatment programs for the children who were having mental health illness there. So it was first an issue. I'm not a medical professional at all, so if I get out of line, y'all straighten me out. But identifying those issues, trying to determine through other professionals that I work with, whether it was a mental health issue, something to do with the environment. There are a lot of environmental stressors, as Dr. Gant talked about, that causes things that look like mental health issues. It might be sleep deprivation, it might be malnourishment, other things that causes a person to act out and do things that they normally wouldn't do. A lot of our children are in survival mode a lot of times, and what I saw when I worked there as an attorney were a lot of children who were basically fending for themselves. They were taking on the roles that their parents should and becoming providers in a home. You may see an expensive car out in the driveway, and children giving their money to their parents every week, and they're not working. Or how are they doing that? Whatever got them to juvenile court got that. So then you have other children who are not being taken care of in other ways. They're not being watched or things like that, and they're getting abused. So we have trauma, and then we have ACEs and all the things like that help us with those trauma-based support for the children. We received training when we were down there to deal with children who had suffered for trauma. So I think a lot of programs are being put into place for children and adults around the city. I know I'm doing my part with mental health court, trying to stamp out the stigma, making people aware. And I talked about earlier today, we people, including myself, we are the majority. Statistics show that 4 out of 5 people over the span of a lifetime will have a mental health issue. Now that goes from some of the as little as a little anxiety for a short amount of time, a little depression. We lose family members that are important to us over a lifetime. Some people recover quickly, others do not. They might need medication, counseling, anything you might need that for. But 4 out of 5, that's the majority. And once you say that to people, I think they really get it. And they understand how people don't cycle out. Speaking with someone earlier today, it was usually that uncle or aunt that we had that was a little bit strange. They stayed in the back room. We tried to avoid them as much as possible, but they affect everyone's life in the family. Everyone dealt with it. We knew how to deal with that uncle or aunt. We knew to leave them alone, or something might happen to you if you get them a little cross, and they might not have taken their medication today. Certain days you stay away from them. If they had a little to drink, you might need to stay away from them until they slept it off or whatever it is. But we've all dealt with something and someone over our lifetime like that. So I think the community is starting to accept it. We're putting programs in place, especially, I think, as I see it, to help the children, right? And I'm doing my part at mental health court to make sure people receive the treatment that they need. It's about an 18-month program, people with misdemeanors, nonviolent crimes, to get back into the community, a journey of self-discovery to learn what their triggers are, what their stressors are, so they can identify those and deal with them properly. Whether it be medication, counseling, diet, holistically, their environment. Some environments we should live in if it causes us stress. So I think the community is doing a pretty good job of recognizing these issues.
Thank you. I love that we always have insights that are shared from our panel of programs that are happening in our community that we may or may not know about. So, Dr. Malone, turning this to you, as we think about environmental impacts and issues, what are the physical conditions that you are seeing most that are clearly tied to stress as well as emotional strain? And what would you change if we treated the entire whole person and not just their symptoms?
The answer to the first part of that, I would have to say everything, because it could just be from chronic headaches to hurt all the time. I'm so weak. Those are a lot of the vague, non-specific things that everybody has at some point in their life, but what makes it exaggerated many times is that just may be a symptom of what they're going through. We see people all the time that comes in, and most of the time they say they've been dealing with it for a long time, but they just can't handle it. And I think there are many times that it's beyond primary care. Primary care is usually just the first step that people come in contact with. Everyone says now, since I guess PCP has come into vogue, and many times they'll say you need to go see the PCP, whether it's you call them on a hotline and someone asks, do you have a regular provider? When you leave the emergency rooms, they say follow up with your PCP. And as a PCP or primary care provider, we only have 10, 15 minutes to sit down and talk to the patient. And as I stated earlier, you get so much from listening to the patient, and if you don't have time to listen to the patient, that's a problem. So I think we need to have more mental health integrated into the primary care sites that we have. It's been tried in many forms, and sometimes it works, but with resources being the way they are, many times the mental health aspect is separated. And again, if you have to come and see your PCP, then go see your mental health provider, many times you don't keep both those appointments, or it's not flowing and one provider's not talking to the other. Many of the mental health records are privileged, so we as primary care providers can't have access to that mental health information. And frankly, I think if you have a patient that's tremendously stressed, have a lot of things going on, you would need at least 30 minutes to sit down with that patient to feel that you can make a difference. But knowing you don't have half that amount of time and you have to move on, it creates a problem. So understanding, compassion, and listen to the patient and have the patient feel that you care about what they're having to say and be willing to take that next step, whether it's give them a brochure to say call this number and set up an appointment, or whether you have to call crisis intervention. I don't have the answers. If I did have the answers, I'd probably wouldn't be sitting here now. But I think it just takes, the beginning is to listen to the patient and work with them and understand that at some point in everyone's life, we have situations, I like to call it situational depression, because sometimes with the little things, family members passing, you're going to grieve. Grieving is part of life. And the depression that we all have, whether or not we didn't get a certain job, we feel bad for a while, but we usually get over it. So depression is not something to cause or to feel ashamed of. It's something that once we have a better understanding of it, we have a better chance to move on past it.
Thank you, Dr. Malone. And you're right, when we think sometimes about grieving, we think about loss of family members, but to your point, you have everyday grief. Losing a job, losing a friend, not getting something that you wanted. And I will share this with you. We learned it years ago in a leadership training, and it's tied to grief and it's tied to change and depression, and it's called the Sarah model. So when you think about going through any grief, you often go through Sarah, which is shock and surprise. A is anger and agitation. R is resentment. And then hopefully you move into acceptance. Depending on how you spell Sarah, if there's an H on the end, it's also hope. So I wanted to share that with you because it was life-changing for me when I heard it, but also that grief is not just the loss of family or friends, it's also everyday losses, things that we hope we would have. Dr. Malone, you mentioned something that I want us to continue on, was just integration of mental health. And so Dr. Gant would love your perspective on if in the very first patient interaction, if we combine both physical and mental health, what would that look like and how can we better treat our patients and communities?
Okay, I think what it would look like is, for one, it'll look like a unified process, not just focusing on the physical symptoms, but focusing on those things that we spoke about. Sleep, if there's an issue, how someone actually is feeling. Making sure that there's a team effort behind the scenes to meet the needs of the patients. Making sure they have available resources. One of the things Dr. Malone talked about is community resources. Make sure we are matching the patients up with the resources we have in the community. Sometimes patients can't always come in the office. What can we do? Like, we have mobile units that go out in the communities to see our patients because they always don't have the transportation to get here. Sometimes they don't have the motivation to get here. So what we need to do, instead of always saying, come in, let's go to them. Go out into these communities where we know that transportation, gas are all-time high at this point. So go out and see our patients. Make sure that they're not having to answer the same questions 5 or 6 times to each provider. So providers collaborate together so that the patients can feel comfortable. That way they develop a sense of peace and, they trust you. They need to be able to trust you to continue to come back in. We just have to continue to motivate them to follow up with their health care and offer them the services that we have available that they may not be aware of.
Thank you, Dr. Gant. You raised a critical point around barriers. So I'll ask you, Judge Renfroe, what would you say is a barrier to entry as we think about in our community, whether that's mental health, physical health, emotional health? Are there other barriers in our system, in our community, that are keeping people from getting their needs met?
Well, typically we found in our program, it is funded by the State of Tennessee Substance and Mental Health, Substance Abuse and Mental Health Department, that most people's barriers are financial to getting what they need. Comes with that is insurance, their ability to maintain employment that provides insurance, transportation, but it's mostly economic. Now, Doc here, Dr. Malone indicated when he first started speaking, that sometimes he doesn't see patients for a couple of years. You know, some people just don't have, I guess, what would be the correct word? The knowledge, the information about self-care that demands that they be consistent with their treatment. That annual physical usually is not affordable, so it's not on the forefront until we feel a pain, until something isn't right, until oftentimes it's too late. That I guess goes with discipline as well. But if you don't have the resources, you don't have the means to do a doggone thing, is what I'm finding. And that's usually what it is for most people, especially those who come through the justice system. And what we do in mental health court is we connect them with resources. So that goes back to what I talked about, the knowledge. If you don't have the knowledge of those things available to you, you can't utilize those resources. There are many out there. I know with this administration there have been many cuts, especially with regard to mental health, but there are still many out there to provide services for you. And the thing that these youngsters have that us dinosaurs like me didn't have back in the day was usually things are one Google search, one click away. So don't be afraid of it. Just embrace it. Seek help. Most times we know when something isn't, when you don't feel right. Like Doc said, when I don't feel good, I'm hurting. You can't get out of bed. You can't get motivated to do anything. Your body tells you what you need to do. You need to listen in most cases. And many of us, I think, are guilty of that. We want to be resilient. We want to be the matriarchs and patriarchs of our family, superheroes, especially those my age. You want to keep going, keep providing and doing things, but you can't take care of others. Diana Ross said it, if you don't take care of yourself first. So I'll leave it there.
Thank you. I think a lot of what you mentioned is making sure we're treating the whole person, but from different perspectives, right? And so Dr. Gant mentioned this, and I think Dr. Malone alluded to it, so I'm going to turn it back to you, Dr. Malone. As we think about the best ways to serve our patients or our community, how can we do that in collaboration? How can we make sure we are bursting through silos and not allowing, one physician to treat this area and another person to treat another area? Where can we come together to make sure we are bringing community, civic systems, and healthcare together to meet the patient's needs?
Well, I guess first of all, we have to have resources. Having done administration as well as being in the trenches, over the years, we've tried different things. We've had mental health professionals embedded in the clinics to see our patients. While we're there, we can walk them down the hall, introduce them, give them that sense of continuity. And there is no one size fits all. Where I work, we have primarily nurse practitioners now, which is a shift from the way that it used to be. And I think that's a good thing. I think we work as physicians in collaboration with the nurse practitioners, and a lot of them are really, really good. Frankly, all of them that I've worked with have been really good, and some have been really, really, really good. And we have some patients that frankly would rather see the nurse practitioners because, again, that nursing component allows them to have more compassion and understanding and caring for the patients than frankly many of the docs. And but we all are driven to try to do everything for everybody, but the realization is that we can't do everything for everybody, and just make people feel comfortable. There is a lot of distrust, and a lot of it is from the past, things that happened in the past, and people don't want to believe what you have to say. And I think currently social media and just regular media and commercials have brought about a lot of distrust. Every day I have patients coming in telling me what they want, and they read this about this, and they want that, or the medicine I give them, they read something that they wouldn't say, give their dog. And I have to sit down and explain to them. My first question usually is, well, where did you get this information from? And most of the time they said, I saw it on my phone, or I read about it, but they can't quote me an article or bring me something in. And I always tell them that if you can find something that's been validated and you tell me, I'll just tell you I want to read it because I might change my opinion a little. But developing trust is hard. It really is. And unfortunately, the younger generation, they believe that they know it all. They do. They tell you what they want, and how come I can't have this because my friend had it and she said it worked for her. And that's just not the way that it works. I have many patients come in and when they leave out, they're not happy at all. I have patients that want to curse me out, and that do curse me out, but always having to take the high road, we have to try to feel that if they knew more about the situation, then they would behave differently. So I try not to go low with them. I may have to get up and leave the room and tell them I'll be right back and take some deep breaths and go back and try to do it. But it's all about meeting people where you need them at. Some people you have to go 90 and they only give you 10. I have some patients that they're more than willing to do whatever, and those are usually my 65 and over patients. So medicine has truly evolved. And the other thing that now we have that we didn't have before is electronic records. And with the electronic records, it changes things. It gives you the ability to get more information than we've had before. We can Google. I Google things when the patient's in the room, and it may help me in a way, and it helps people because they figure that this is the way people do things now, Again, everybody's got a cell phone. When I started, we didn't have cell phones. We had paper charts, and again, cell phones really hadn't been here that long, since about 1994. Now everybody's got one. But I just try to have the patients to believe that when I talk to them, I am sincere about what I'm saying. And many times they believe me, and I've had a lot of patients that have several members of their families come back to see me. And it's a good feeling when people refer their brothers to you or their parents to you. And I try to make them feel that the decision was good. I haven't lost a lot of patients. Some patients I've been seeing for 20 years. And I still enjoy this, but everything has to come to the end. It's coming up 40 years I've been doing this. And I wish that we had more people going into primary care. Younger people nowadays, primary care is not that attractive. They don't pay a whole lot of money, and it's one of those areas whereas everybody, if they don't have the answer to something, they'll say go see a PCP about it. And it's something that needs to be done. Many times I get things that I shouldn't have to be doing, but if I didn't do it, who's going to suffer? It's going to be the patient. So I wish I had 30 minutes to see each patient. I really do. But I guess that's not financially possible because the administration, seeing each patient for 30 minutes, they're not going to be able to keep the doors open. So it's always a struggle in order to figure out how we can get, I guess, more for less. It can be done. We haven't figured it out. We've tried a lot of things. Some things work, some things don't. We adopt some things, and some things that we let fall by the wayside. But I do believe that when we had a licensed mental health provider in our clinics at one time, I thought it worked real well, but that was a grant-based program, and the grant ran out and the program ended. So innovative thinking from our leadership, as well as communicating with the people in the trenches that can give you valuable advice. I think that's going to be the key to making things happen and making the patients more comfortable.
Thank you.
That's enough.
Thank you. Yes, that was great. We're noticing some patterns here. You know, we like to spend time with our patients. You've been practicing for a while, and that's all we'll say there. Okay. Dr. Gant, we're shifting to you. Dr. Malone mentioned something about just misinformation, mistrust. But to add to that, right, I think there are some statements that we always carry. So as people are experiencing whatever health outcomes they're going through, we hear things like push through it, or don't talk about it, or we pray about it. You talked about praying in the beginning. We're often told, just pray about it, and it'll all be okay. How do we shift people's thinking to make sure they have better health outcomes, without dismissing those thoughts or things that have been shared with them and probably passed down from family?
One of the things that we have to be mindful of is the words that we say. What it means to one person, it may not mean to the next person. When you say push through it, you're telling someone who may be hurting or experiencing different health outcomes or barriers to push through it. Well, they've been pushing through it for a long time now. So how long does it have to continue to go on? So we have to be careful when we say push through it. Then we say pray about it. That is one of the things that we hear all the time. Yes, we want you to pray about it, but we want you to act on it as well. Right. Just like prayer works, getting up, making the necessary movement to get the help that you need works as well. And then we say don't talk about it. You may not realize those kind of statements will shut people out. It leads to isolation and makes it can lead to depression, those kind of things. So when a person has something going on, they may not want to talk about it because your statement was, don't talk about it, push through it. And so you're minimizing how they're feeling. So we have to be mindful of the words that we say and really encourage someone to talk about it, because there may be resources or something that we can do to help you. So my whole statement about that is just be careful of what you say. Expand on what you're saying. If you're going to say, don't worry about it, we're not going to worry about it, because guess what? I'm going to get up and take you to the doctor in the morning. If you say push through it, I'm going to get you what you need to get to the doctor. If you need gas money, we're going to do that. So just be mindful. If we say we're going to pray about it, let's pray. But at the same time, we're going to act on it as well. So just be mindful of the words you say, because they have different meaning for people.
Thank you. That's good. As we talk about these generational statements, I am going to shift to Judge Renfroe as well, because as we think about generational statements, there's also generational trauma. And trauma has become a word that people are very comfortable with today, but I think many people have experienced trauma in different ways. And so how much of what we're calling a health crisis is really undiagnosed or unaddressed generational trauma? And how can we be ready to fully name that, but also address it? Deep question for you. You got all the special questions.
Well, generational trauma, something passed on through the family. Sometimes the things that Doc mentioned, one of the docs, that's hereditary. And that's important to identify and learn to address. Quite often, we hear stories of our participants that come through the program. We hear that I got this from another relative, and we dealt with this in the family, and this is how we dealt with it. And, they're very sad stories to hear, the things that come down hereditary, the trauma that comes through the families. It can be generational abuse as far as sexual abuse. It could be physical abuse. It could be, I think, even poverty can be traumatic to families because it limits your access to so many things that you need, and it's so limiting in how families can, I guess, succeed in society. And I don't mean getting, large homes and cars and things like that. It's those bare necessities sometimes. Those things that make children not want to go to school, not want to interact with others. Those are the things that we deal with even in court that affect families generation after generation after generation. And these things, whether they're hereditary, whether they're environment or whatever that are passed down, we need to teach our youth about how to deal with all these different types of trauma. Whether it's something that needs to be addressed by a medical professional, whether it's something, I guess we can learn from others, meaning, groups like such as this, and we learn about how to deal with the traumas that affect those, but we deal with it on a daily basis in the courts. But it's on a case-by-case basis how we deal with the individual, the trauma that they have.
There we are. So you talked about poverty, and this is for you, Dr. Malone, and I do want to prepare the audience that I will open it up soon for you to ask any questions. So if you have questions, think about them, be prepared to share with this wonderful panel. But if we had someone who has limited time, money, and resources and access, what are the things they can do right now to start impacting and improving their health?
That's all too common problem that we have, and I think that there are no easy solutions, and I think there's different things that different people would do that would fit them. So to come up with a general, you can do this, I think would be sort of far-fetched, but everyone can work to improve their self-awareness, their self-esteem. We like to have people to feel good about themselves. Our health is what we make it, what we call it. We have people who are very healthy if we go by their numbers, their blood pressure, their cholesterol. But they may not be healthy people. Sometimes people, when you talked about generational tragedies and what goes on in the family, many times that can be sort of prevented or slowed down. I like to talk to people in the sense that what makes us who we are, I think there's 3 main components, and I talk to my patients about some things we can control, some things we can't. I think that who we are is number 1, our DNA, which is something that we can't change. We're gonna get some DNA from our family, and whether we like it or not, we deal with that. The second is upbringing, which is a big one, and that's where a lot of the family issues come in. I've had family that come to the office, and I've been seeing for a long time. They come by themselves all the time, and everything seems fine. I have some patients that may be a little bit slower than others, but still they're functional. They do everything for themselves. They can catch the bus. They can cook their own food. They may live in a household with other family members. But I've had quite a few that a family member may show up with them one day, and one in particular I can remember not long ago, the family member asked me a question. She said, she's challenged, don't you? And I'm like, no, she seems fine to me. And the family member talked about the person going to special classes when they were in school, but this lady was in her 60s, so that was a long time ago, and she still managed to take care of our own business. But things like that used to hold people back, because when that other family member came there, she hardly talked anymore. She just mostly was listening to the other person define who she is rather than her defining who she is. But the other third component, we talked about the DNA, we talked about the upbringing, and the third is life experiences. And everybody have different life experiences. You can come from a family and you got 10 kids and everybody's different, because even though you were raised in the same house, you have the same DNA, but who you hang out with, what path you choose. When it comes down to making tough decisions, sometimes our upbringing would overcome a lot of it. We hear our parents' voices telling us this and that, and we make the right decision, but sometimes your friends can influence you more, and you get to smoking and drinking and hanging with the wrong people, being in the wrong place, and other things can happen. But that is who we are, and we try to and have to take people for who they are. No one person is better than anybody else. Some people are just different than others. But we have to meet everyone at some point in which we don't want to be a detriment to their lives. And I try to keep in mind that when I'm talking to a patient, that they don't have to be here. They chose to be here. Maybe sometimes they're forced to be or pressured to be there, but I try to treat them as I would treat any other patient, and maybe they want to come back, and maybe whatever it is that had the person feel that they needed to be there, we can improve upon that, or we can open up new horizons. So.
Thank you. That was perfect. All right, I am opening up to the floor. What questions do you all have for this wonderful panel? Thinking about physical, mental, emotional well-being, your overall 360 health. Questions? That's great. Oh, there is a question. I was going to say, everyone is living well in here.
Thank you. This question will be to Dr. Malone. You spoke about the trust issue and sometimes the non-compliant with medication. What would you say, or what do you say to patients when they've been taking medications but they feel like the medications are not making them any better, so they stop taking the medication, or they are taking the medications and they're seeing their health still declining? I know some of it is lifestyle issues as well, but how do you address that with your clients, with your patients?
Well, I usually try to ask open-ended questions. If the patient, number one, if they tell me that they're taking the medications, and sometimes they're being truthful and sometimes they're not. You know, I may ask questions like, let's bring the pill bottles in, and we count the pills, and what time of day do you take your medicine? Even though sometimes it may not be a big thing as to when they take the medicine, but if they're listening to me, they're trying to figure me out just like I'm trying to figure them out. I think everybody wants to feel good and nobody wants to feel bad. And compassion, empathy, and I think if we stress that everybody's different, and sometimes you have to continue to try to find your joy. Medications is something that helps us, but it should never be what we reach for first. We want to feel good about ourselves, our inner peace, and medication just being a supplement to what we're trying to do. Now, with medication, lots of times we can get objective measures. We can see how it's working. If you take a blood pressure pill, you can recheck the blood pressure, and if it's come down, then the medicine is doing what we want it to do. But we don't take into consideration a lot of the medicine may have some undesired effects that's making the person feel different. So their blood pressure may be better, but their thinking, thought processes may not be a little bit better. I think if we spend time with the patient and encourage the patients to talk to us about things like this together, as long as we're listening and communicating, we can work through it. Sometimes we can't, but I don't think there's ever a case where we're saying we're shutting the door. I can't do nothing for you anymore. You need to find another doctor. Everybody's different, and if you can get your patient to be honest with you and feel that they're being honest with you, I think there's room for improvement.
Thank you. Any others? Okay, well, I have a question to close our panel. Two questions, actually. Dr. Malone, you talked about finding your joy, and so I'm going to give this to you in advance because you all probably need to think about it. And I ask every panel the same question. You all are not exempt. So what is the one song, and this is the last question, I'm asking a harder question before this. What is the song, your hype song, the song that brings you joy, the song that represents you being in good health and living well? Write that down, make a mental note. I just wanted to give it to you in advance because the real question that I wanted to ask you before we close, especially since we had election night yesterday, if you could change one policy or investment that would improve our health outcomes, what would it be and why? I'll go with Judge Renfroe first. Dr. Malone, go ahead. Okay, you're grabbing the mic.
Well, I think I would wish that healthcare would be available for all. I think that the lack of healthcare and with people having to resort to going to the emergency room for their healthcare, it puts a tremendous burden on the system. And you may be able to get money to go to the doctor one time, but don't go back, don't get your medications refilled. And I think we have to do a better job there. I think that the Affordable Care Act and what's allowed us to have more patients with insurance has greatly improved a lot of people's lives. But now I'm seeing, as of this past November, when the insurance opened back up for people to reapply, and lots of the premiums have gone up tremendously. A lot of the patients that had insurance now is listed as self-pay, and they're stretching their medicines, and it's taking us back. So healthcare for all, even though I know it's a monumental task, that's what I would wish as far as being a policy change.
Thank you.
Can I say that over?
That was exactly what I was going to say. Honestly.
Dr. Gant, you have a different answer.
Along the same lines, but one of the things, the policies I would change, waiting periods. A lot can happen during waiting periods and people get discouraged and not want to follow up, whether it's in between jobs, or wait period on jobs. You have to wait before your insurance or access to care that you can have that. So one of the things that I wish would change is that waiting period that can sometimes deter a patient from trying to follow up and to receive the services that they need.
Okay, final question. Now, Judge Renfroe, you will be first, so I want you to be prepared. This is an easier question. So as we close out this panel discussion on health, we've talked about, I think, the serious issues, trauma, we've talked about environmental barriers, but this one is about joy. So as we leave here, we want to bring people back up again and tell us what's your hype song, what gives you joy, what makes sure you continue to live well. Judge Renfroe, please.
I'm a lover of music. I have 2 children, and they're both musicians. Now, neither one of them play music that is a genre that I prefer. So, on a regular basis, I am asked to critique music that I know nothing about. So I resort to, and I stay firm in my own genre when I'm alone, and that's R&B and all those kind of things, or just something silly. And I remember this week my son was talking about kids' movies and things that we used to go to see, and songs get stuck in my head quite frequently. And this morning I was laughing at one, I think it's from Shrek. Hey now, you're a rock star. I just forgot this was being recorded, but you asked me a question. That makes me want to go get it. So I think you should always do what brings you joy, what can make you laugh and face each day, because it changes, because I'm a music lover, and I got into that little, I guess y'all call it a reel or whatever, that don't play with me thing if I'm having a bad day, and whatever works for you. And it changes. It can go from the bubble bath and all those things to a silly song, to a joke that someone told me 20 years ago that still makes me laugh and smile. A good friend that you can call to listen. And I know Deidre knows all about that with her little new crew and her radio show. It's giving me a lot of joy. But, you know, do what works for you. Stay healthy. Talk about it. Have a friend that you can talk it over with. Be mindful about your mental and your physical health. And thank you for having me.
I'll come to you last. Dr. Gant.
One of the songs that really resonates with me is more of a gospel song that I like to listen to. It's Fight On by Kevin Davidson and Voices. This song is really powerful for me because we all know we face challenges, but don't give up, don't quit. Encourage our patients. That's all they want. The same fight that we see, we should instill that same fight into them. So that's one of the songs that really, when you're going through, that's a song that you can listen to really help you get through. It encourages you, no matter what it looks like, continue to fight. When insurance companies say no, continue to fight. When the battle gets so hard that you don't know what to do, continue to fight. So that's one of the songs that encourages me.
That's good.
Thank you. Last but not least, Dr. Malone.
I think this is a pretty easy one for me. It's a song that came out in the 70s, and it's motivational. I've used it a lot through college, medical school, before I take exams, and the words of it, it's an upbeat R&B song. The name of it is Keep On by D-Train, and it's got a lot of lyrics that's catchy, but they mean something. It talks about the sky's the limit, and know that you can keep on, just keep on pushing on. And if you have a goal, set it in your mind, reach for it. Say this will be mine. Ain't no half stepping, no, I have to keep on pressing. It's upbeat. You can put your headphones on, and I would do that for my major exams. I listened to it before I did my board exams, before I got my certification. It just sort of does something for me, and you know, it may just be me in my mind, but it's an inspirational song. It's positivity, and I think I'll be using that song whenever I get a chance. I got my board recertification coming up. I just keep on doing it.
That's right.
It's good for me. But D-Train, Keep On. The second song that I used to listen to also that has meaning to me was Ain't No Stopping Us Now by McFadden and Whitehead. That came out around close to my senior year of high school, so around 1978 or so. And it's a moving, inspirational song, but D-Train, Keep On has to be the song for me. That's it.
Well, we want want to say thank you all for joining us at our TSD and the Community Forum on overall health, mental health, your 360 health. We want to say thank you to our sponsor, Google, because it's important that we have these conversations in our community, and they have sponsored us to make sure we can continue this dialogue. So we want to give you all a round of applause for being here. Thank you.